Hello, and welcome to another episode of the CIRS Group Podcast. I am Barbara.
And I'm JC.
And today, we did it, guys. We made it through. This is our final CIRSx 2024 recap episode. Not to say we won't revisit topics in the future, but this is our last official episode covering the talks that we loved hearing at CIRSx. So very excited to get into it. This is our medical oriented category that we've chosen. This has nothing to do with CIRSx. We've just put a few together that we thought went well together. So today we're going to be covering histamines and seed oils and platelets, hyperbaric chambers, and ADH. It's a solid list. We'll see how we go.
But before we jump in, just a quick reminder that we ourselves are not medical professionals. We are CIRS patients. We have a community of people who are healing from CIRS, and we read the CIRS textbook. And I get a lot of questions about this. It's the art and science of CIRS medicine. You can find it on Amazon. But we're not medical professionals, so don't take any of this as medical advice.
Beautiful. Yes. So without further ado, the first talk we are jumping into is by Dr. Louise Carder of the UK. I feel like that's important to state because there are not very many practitioners over there on that side of the pond. So she's doing fantastic work over there, fighting a very large battle, I would imagine.
So I don't know if we mentioned this, but Yari, the European's leading air quality expert, half of his presentation was just like talking crap about how poorly buildings are built in the UK.
Yes.
With receipts, like detailed receipts.
Pictures and graphics and showing, yes,
Memes.
the whole thing.
He had
memes.
But it was like when it rains for 7 days in the Bible, it's an apocalyptic event, but in the UK, that's just summer.
Right.
So good.
So good. So yeah, this talk was very science heavy. She really went into the processes at play here when you, as a CIRS patient, are having a histamine response. And because JC is so much better at articulating this, I'm going to hand this off at this point.
So mast cells are white blood cells. We all have them in our body. It's part of our normal immune functions. And those mast cells, I like to think of them as dandelions. And the end of the dandelion, like when it's a puffy dandelion, the end of that dandelion, the little spores that go off, those are the histamines. It's protein and it reacts to foreign bodies in your body. So it is a helpful thing. It's a good thing that you have in your body. It's protective and it's fighting off whatever that foreign body is. But in CIRS patients, we become so dysregulated that some people can have mast cell over reactivity, which is like your dandelions just blow in the wind a lot easier than they should. And then also we have all these biotoxins bopping around in our body. And so we have a lot of histamine response. And different CIRS patients will experience this differently, and different CIRS patients will have a different level of histamine response.
Yeah. And that's some of the important takeaways from that talk that I really appreciated is she was bringing more attention to the fact that it is very common for CIRS patients to have histamine issues. And this is something that was also covered in Dr. Peg and Dr. Christian's talk. An important takeaway that I got from her talk, and I think really her main point that she wanted to hammer home to the practitioners in the room, is that histamines are not necessarily an evil thing. They're not just bad. In fact, she compared it to air, water, and sunlight. Humans need the right amount to thrive. And so she rejected the idea of thinking of histamines as a bucket issue, like your toxic bucket overflows and then histamines or whatever. But instead, she saw it more as a seesaw, and you want to find that balance and harmony within your own body. So it is really important to work with your doctor if you think that histamines are part of the problem for you. There's certainly some supportive therapies that you can do, or not just therapies, but just lifestyle changes that you can do. Obviously, things that we've said before on the podcast, like a lower histamine diet is important. You want to avoid the DAO blocking medication, supplements, and foods, and maybe even supplement with DAO or some foods that would support that. I think she noted legumes and chickpeas. I know we're mostly a carnivore channel, but let's not go that direction, eh? But also using antihistamines, which can come as both medication and supplement forms. So again, talk to your doctor about what would be best for you, and generally avoiding triggers, both environmental and food related triggers in your life. A lot of people in the group, the CIRS group, do struggle with histamine issues. And so it's really cool to see all of them share those resources with each other, try new things. Unfortunately, it does kind of become another one of those things you got to self-experiment and find what works best for you. But there are quite a few options out there for you to try if that's something that you are struggling with.
Yeah, I found personally cromolyn sodium, which is a mast cell stabilizer, so it makes that dandelion a little less likely to blow in the wind. Super helpful for my own CIRS journey. I was having a lot of histamine reactions and I couldn't eat beef for a period of time, but the cromolyn sodium really helped me with that. And just calling back to Dr. Peg DiTullio, Dr. Christian Navarro Torres's combined talk about MSH, they were sharing that people who received histamine support earlier on in the treatment had better MSH outcomes in the long run. So it is something to consider, even if you don't think that histamines are your quote unquote thing. Maybe talk to your doctor about getting some histamine support just so you can have that better MSH outcome in the end. But again, talk to your provider.
Yeah. And one quick stat on that, if you're wondering, like how common is this? She did note in her talk, Dr. Louise Carder, that about a third of genies show an upregulation in histamine, and about a quarter to a fifth show downregulation. So it goes both ways in CIRS patients. And high symptom cluster counts often show up as high histamine as well. So if you have like all the boxes, you are probably more likely to experience histamine issues.
The next talk I also missed, but it's about seed oils.
I was telling JC before we were recording that, she already knows what we were shown in that talk. It's a lot of what is shared in the carnivore space, of course. It's a big push in the health space in general is to eliminate seed oils from the diet. Chris Knobbe.
I was going to ask you if it was Knobbe or Knobbe.
Um,
It's not intuitive that it would be Kenobi,
no,
Obi-Wan.
I know. Well, there was a Star Wars joke at some point. So either that was said to help solidify the correct pronunciation, or it was said to make a joke about how it is often mispronounced. And I can't tell you right now which one it was.
If
So,
anyone knows, let us know in the comments.
more importantly, though, his message was that it is seed oils, but he took it a step further. He showed, and he went by population over the years. These are the graphs he was showing to illustrate his point. But he took, the increase in sugar and obesity, and they didn't quite fit. There is an increased intake of sugar by the population in general over the years, but it doesn't match up with like the obesity situation going on and disease. He was also including like cancers and everything else that's going wrong in the health space right now with most people. So he took apart the argument that it's sugar. He took apart the argument of processed carbs, even. There was not a really strong correlation there either. It was very specifically seed oils. And I know this is something that Dr. Paul Saladino has shown and talked about often. That was like most of his talk with Rogan when he was on that podcast. But it does really seem like that is the culprit. And of course, if you want to learn more or go down that rabbit hole at all, his book, The Ancestral Diet Revolution, would probably be a good thing to look into.
Also, the pronunciation of his name.
Yeah,
Please,
that's
someone comment.
someone tell me I'm wrong, please.
The next talk was by Dr. Jimmy Ryan, the inventor of the genie, everyone.
Mm-hmm.
Every time I get to see him, I fangirl and I think it freaks him out a little bit. Like I can tell he's just really uncomfortable with me looking at him with like stars in my eyes, being like, thank you, you are amazing. He created the genie, which shows the genetic expression caused by CIRS. So things that are upregulated, things that are downregulated. We just talked about it in Louise Carder's talk. His talk was about platelets and platelets' role in our immune functions. And it was very in the weeds, but he did say one thing that really stuck with me because when we talk about CIRS and the genetic expression, we talk about the chronic inflammation putting so much pressure on the genome that it changes the transcriptome. And the transcriptome is the expression of those genes. And he put it in such a tangible way. He is an incredible educator. He's really good at like metaphors and analogies. But what he said is that DNA is like a guitar, and your genome is the guitar itself. It's the strings. And those are stable, right? They are what they are. But the transcriptome, the expression of those genes, are the music. So depending on how those genes are played is how they present in your body. And I was just like, for those listening and not watching, I did like a mind blow expression.
Good work describing that. Yeah, I love the way he puts things together. It felt a little, and anyone who gets a chance to experience one of his talks, if you think it'll be over your head, it I don't know, because if you can watch, the pictures he chooses are so great. Like it kind of reminds me of like a Miss Frizzle Magic School Bus meets Bill Nye. Like there's just a lot of stuff coming up for, the older millennial that I am, that really work for the way my brain wants to hear science. So I really appreciated that. The thing that I was just impressed by, and I didn't realize, is that platelets activate differently. They're expressed differently in people with CIRS versus controls. And he explained like their little arms going out and like how they attack things, and then how that breaks down the blood-brain barrier, and that's what causes all the inflammation issue in the brain. I mean, it's kind of wild how much platelets have access to in the body. And when they're going wrong, that's why we have so many issues in so many systems. And it was cool, for lack of a better word, to understand exactly how that process is happening and what parts of what cells are doing what in that process to cause all the havoc and chaos that they do. So I appreciated that whole explanation. Again, it was like a, I don't know, Saturday morning cartoon moment for me a little bit, but with some science sprinkled in. I enjoyed
When
it.
he gets on stage, it's like you're walking into your classroom and the lights are off and the TV is in the front.
Yeah.
It's that exact feeling. You're like, heck yeah.
Yep. So the next talk was, they called this like an ed talk, just like the Air Oasis. So technically, again, this is someone showing up. They have a product or service that they are selling. I like to say that up front so you guys know what we're walking into. But Dr. Meyers, who is the person who was talking about his hyperbaric chamber treatment for people with CIRS, he had some powerful, beyond powerful, well, a powerful story, but some general powerful information about the benefits of what he does. So he opened with a really powerful story about a girl who's 14 who got into a horrific accident. I mean, her spine
Was
was like
shattered.
it,
Shattered is the word.
yeah, and shattered like you wouldn't think you could put that back together. And so the doctor told her she's not going to walk in. She was a soccer player, athletic, whole life ahead of her, all the things. And incredibly, and of course, Dr. Meyers did say, and I love that he said this, I want to preface this entire story with, this is the hardest working, strongest person emotionally, physically, spiritually, mentally that I have ever worked with. That's important to say, because it's not just go do a hyperbaric chamber and you can walk again. That's not really what happened there. She was working probably every waking moment of her life to get back to walking. And yes, she did the hyperbaric chamber as well, in addition to all of that. And with all of that, she was walking in like a shockingly short amount of time. I can't remember right now, but it was like she was back to playing soccer in like a year or two. Like, wasn't it
Yeah.
like just a year? It was something ridiculous that you just wouldn't expect. So we were all crying. Let's just
Yeah,
say
I looked
that.
down the row of people I was sitting next to. I was crying. Barbara was crying. Everyone down the entire row was just, they need to put tissues out at CIRSx because I cried Every year I cry. They
Uh,
need tissues.
yeah.
That was an incredible talk. Dr. Ryan shared that the surgeon did an impeccable job, but even after the surgery, they told her she might have not ever walk again. And he shared a video of her walking after just a month, 2 months of treatment in the hyperbaric chamber. And oh my gosh, that was such powerful imagery. A couple takeaways that I got from that talk is that one, he said it can help clear stubborn MARCoNs. So if you're someone who's been struggling to clear MARCoNs, hyperbarics might be a modality you want to look into. He also shared that it can improve mitochondrial function, which for me is like my brain was like, yes, because my whole mission with CIRS right now at this point in my treatment is how can I become more resilient? And one of the ways that I've identified is by really babying my mitochondria. So I'm definitely interested in trying hyperbarics. For CIRS patients specifically, he said it could reduce TGF beta 1, MMP9, C4A, and he has seen improvements even while patients are still in exposure, which is incredible.
Yeah, that is wild.
The last thing I'll say is, and he mentioned this not only in his talk, but also in the panel discussion after the fact, that different hyperbaric clinics are very passionate about the oxygen saturation and pressure that they specifically use in their hyperbaric chambers.
So if you're wondering what he recommends, what his practice does, his comparison to normal, what we're breathing right now versus what he does. So in normal situations, we are breathing about 21% oxygen, and that's under normal pressure. But when he increases the pressure to 1.3 in the chamber, it jumps to 93% oxygen. And basically everything benefits from higher amounts of oxygen, and it grows new blood vessels, and that means there's new ways to deliver blood and all of the things that your body needs. And what he usually recommended for CIRS patients is doing 3 to 5 sessions per week. If that's something that you want to look into, there was some debate about like the pressure level, like you were saying. Some places want to do higher pressure. He saw that the problem with that is you're more likely to experience a blown eardrum. Like that sounds horrific. Like I want to do the least amount, please, and thank you. So I imagine there's some diminishing returns and or more complications like that if you go beyond the 1.3 pressure that he's recommending. So that's something to talk to your own place that's near you and what they do. We'll put his office's information in the show notes in case you want to go directly to the source. If you happen to live locally, that would be awesome. But yeah, that's something to just consider what the pressure levels are that people are using in your area. And maybe you want to pick a place based on that.
Yes, because he did say that if you find a hyperbaric place that you can get therapy at, they are not going to change the pressure for you because it changes all of the settings on the machine. So you kind of have to find a place that will do the pressure that you want.
And the last talk that we are covering today is, what was his clever title? It was,
Pee all you can pee. Because
P.
people were asking me, they were like, does this mean we should try to pee more? And I was like, no, if you have this issue, you're already peeing too much.
Yes.
But he was just
Yes.
being funny.
He was being funny. And in fact, he did say that he may no longer do talks on ADH osmolality issues because he is out of clever titles for these
Unfortunate
things.
for
Because
us.
if you couldn't tell from all of that, this was done by Dr. McMahon. So, I mean, your other guest could have been Dr. Dorninger, and that would have been fair. But no, Dr. McMahon took on this topic.
For a lot of CIRS patients, our ADH osmolality can become dysregulated. ADH is antidiuretic hormone. It regulates the water retention from your kidneys. And osmolality is the concentration of electrolytes in your blood. So when those become dysregulated, we can have a lot of issues.
Yeah. So one of the things that Dr. McMahon will ask new patients to see if they have an issue with ADH osmolality ratio funness is, how often do you pee? And the smart ass answer that he usually gets is, well, it depends on how much I drink. That aside, and that's true because I noticed that I actually do drink a lot less water generally because I pee a whole heck of a lot if I do drink a lot of water, and that's annoying. That is not necessarily the healthy thing to do, just for the record. Generally speaking, a normal person without CIRS is not peeing more than 3 to 4 times a day.
Which blows my mind.
Yeah, yeah, it's wild. And I think if people led with that, if we just did a survey of the population, how many times per day do you pee? And then just use those answers to go, okay, you have CIRS. I think that would be helpful. I think that would really, because that's, yep. But also, yeah, I mean, I think I've had CIRS my whole life if this is the screening question.
Yeah, very interesting because I think we really start to normalize our symptoms. We
Mm.
say, "Oh, I'm getting older. That's why I get up in the middle of the night to pee," or, "Oh, I've been
I've
drinking a
had
lot of water."
kids,
Yeah, I've had kids. I'm drinking a lot of water today, and that's why I have to pee so much. And it's like, no, your ADH osmolality is dysregulated. You might have CIRS.
right? Yeah, your brain and body can't communicate in the way it should to be like, oh crap, there's not enough electrolytes in your system. We need to like, release pee or the opposite. And the other thing that you should know is because you said, peeing at night, if you're an adult under the age of 45, you actually shouldn't be getting up to pee at all in the middle of the night. You should be able to hold it through the night until the morning. Once you are over 45, waking up once to pee is normal, but more than that is a problem. So that's another thing to keep in mind as well.
This was another talk that briefly touched on kids, and he was talking about bedwetting. And I guess I'll just do the encouraging takeaway from his talk about that is he's seen incredible improvement treating kids with CIRS and having them improve in their bedwetting.
Yeah, any bedwetting past age 6, you really should look into CIRS. I will say I've also heard that that can be a sign of trauma, which also can be a trigger for CIRS in the first place. So there's a lot of stuff there to get into, and I know that that can be a heavy subject, obviously. So, but that is something that if that is occurring, CIRS is definitely a thing that parents should look into to see if that might help their kid.
And ADH osmolality can correct on its own through the Shoemaker protocol, so removing yourself from exposure and taking binders. But some patients may need to do desmopressin, which is the treatment option for regulating ADH osmolality. And if you do go that route, it has to be supervised by a practitioner. It's fundamentally safe, but needs to be monitored. And so make sure you're working really closely with your CIRS provider if that is the route that you need to go.
If I want to take a warning seriously, I need to know why. If you take too much desmopressin, it can cause seizures. And that's not a reason to not do the treatment, but it is the reason to do so very carefully. A good doctor is going to do the lowest dose possible and try that first before upping it if that doesn't work. So definitely follow your doctor's advice, just like JC said.
And the cool thing with desmopressin is if you have done the Shoemaker protocol, removed yourself from exposure and taken biotoxin binders, the effects of it are persistent and it is a very short course of treatment. So if you're someone who's like, I don't want to take more medications, totally feel you, neither do I. But if it's a short-term course for a long-term fix, that makes me much more willing to do that treatment.
Absolutely. Yeah, me too.
Well, that's it, guys. That is the CIRSx recap, last episode.
We
Come
did it.
back next year for more. We have a weekly podcast, though, so you could just keep listening in the meantime. And a lot of what we talked about today was definitely, you kind of have to trial and error on yourself, work with your provider to see what modalities might work well for you. But one thing I can say about our group is that people are very open about what has helped them and what hasn't helped them, which sometimes is just as helpful. So if you are looking for more resources and support in your CIRS journey, you can join us over at the cirsgroup.com.
Yep. And we'll see you there.